for more on this now, we're now joined by the Samatu Mpumalanga Provincial Chairperson, Dr. Mandla Matshabe, and he joins us now via our video link. Dr. Mandla, thank you so much for your time this evening. Now, today you took part in a protest in solidarity, of course, to some of the pharmacists who are facing a number of issues in Mpumalanga. Maybe just give us an insight in terms of what exactly are these issues.
Firstly, thank you for having us. I think we participated as a trade union in the march that took place today, following our own march that took place on the 17th of January 2025, where we were raising complaints against the Department of Health for the understaffing in the hospitals. And I think as you've correctly mentioned it, that when one side is failing, others find themselves now being used as replacement, with nurses being used as pharmacists, and sometimes doctors having to also realize that function. So we pledged our solidarity to ensure that there is sufficient staffing in the hospitals, to ensure that the rollout of NHI is going to be supported and effective and will benefit the poor residents of South Africa.
Another issue, that you are trying to address is the issue around that there are jobs available, but they are not being filled. How long have these jobs been left vacant?
One of the things that we have realized is that the department will always speak to vacant but unfunded posts. And this is a problem because the post is there, but there are no funds to ensure that it is filled and that we have a person who is going to render those services. So what we have requested, and hence the national structure of Samatu led a march with COSATU to go from the union buildings to the Minister of Finance, whereby we were requesting that finance makes funds available for the employment of these necessary healthcare professionals. But this also, the issue of finances also affect the infrastructure. We are working in dilapidated hospitals because they have not been revamped and renovated. And those hospitals that the government has said to be trying to build anew, like in our province, like Mpumalanga and Middelburg, are taking forever to complete, and our patients and staff are subjected to terrible conditions when it is raining because they flood, and we work under strenuous conditions on the basis that there are no funds. So we have requested finance to make funds available, but we have also gone to the Department of Health to say that you must also exert pressure with us to the Treasury to ensure that these necessary healthcare professionals are employed and the people of South Africa can benefit.
And when it comes to pharmacists exactly, how important is the role of pharmacists, especially now where we are seeing their role being delegated to nurses who also have a task at hand?
Basically, it means that the shortage that we have is just exacerbated. For a doctor to function, there needs to be a multidisciplinary team. Pharmacists employ that important function of ensuring that anything that is prescribed by the doctor must be received by the patient. So the ecosystem is going to be disturbed and patients are not going to be able to get their medication on time, which means that even if there is good work that is being done by the other medical staff that are employed, there is going to be a gap that cannot be bridged. And the problem that we are having at the moment would be that you would see some hospitals would go for a night without a pharmacist, which means that a granny who has come only because their BPs were raised, now are controlled, would have to wait overnight to be able to access a pharmacist that is going to come in the morning. And we are saying that such an instance cannot be a norm, and we cannot accept it as a trade union. So hence we stood firm today, and we will continue to stand firm to advocate that healthcare professionals must be prioritized, and there must be means made to ensure that healthcare professionals are employed.
And maybe just talk to us then about, some of these pharmacists who are sitting at home, who are qualified for the job, and who are sitting at home and they are jobless. How has this actually affected some of these pharmacists?
Well, I'll speak in general on the basis of anyone who's unemployed and is a graduate, be it a pharmacist, a doctor, a nurse, or a physiotherapist. The World Health Organization defines health as a state of biopsychosocial well-being, meaning that all of these have to be in harmony in order for us to say a person is healthy, and not merely the absence of disease. What we see happening now is that the psychosocial aspect is being affected greatly, and as one would have mentioned already, that we are running a risk of having a vicious cycle where hurt people, because the people who are responsible for rendering healthcare services must be the ones who are deemed to be healthy, and healthy not only because there is an absence of illness or disease, but healthy because their biopsychosocial well-being is taken care of. And I think government is failing on that, and there are serious and dire consequences that arise from this, because we are now subjecting these youngsters, be it doctors or pharmacists, to grueling circumstances because of the unemployment, and obviously this is going to affect them mentally. So we are pleading with the Department of Health to find means to ensure that they employ healthcare professionals, but also to ensure that such does not become the norm, because it would seem that every year in January, February, and March, we need to take to the street, leave the very same patients that depend on the public healthcare system to queue for long hours, because doctors, nurses, pharmacists, and even the cleaners in the hospitals have to join hands and go on a protest to demand for doctors to be employed, for pharmacists to be employed, for allied healthcare workers to be employed. So we are saying that let us find a sustainable solution to the problems that we are facing, because it is only a fool who does the same thing multiple times and expects a different outcome. We are led by very conscious people who must apply themselves and their minds to finding solutions and ensuring that we do not find ourselves in the same place next year, organizing marches and subjecting our poor people to longer waiting times, which is something that the president mentioned in the SONA, to say that they want to better the healthcare system, they want to reduce the waiting times in the hospitals, and also mention issues of cleanliness. But we are saying you cannot improve on the waiting times if multiple healthcare professionals from different disciplines are still idle at home without employment.
Yeah, and of course, I mean, you held a protest highlighting this issue in January and another one today in solidarity with Nahau. What is your message, to the Mpumalanga provincial government as well as national government as a whole?
Basically, we need to revert and look at the implementation of the NHI and understand what it means for the country. Samatu has stood firm to support the implementation of the NHI, even when it was still a bill. And we are saying now, in order for the NHI to be properly enrolled or rolled out and implemented, we will need more healthcare practitioners in the system, which means more doctors, more nurses, more pharmacists, and physiotherapists, and the list goes on. So it is imperative on the government to start creating avenues to ensure that healthcare professionals are being employed, so that we can be able to benefit the poorest of the poor in the marginalized corners of the country. And NHI, by nature, mimics or actually puts into effect primary healthcare, whereby the primary healthcare centers, the community healthcare centers are going to have multidisciplinary teams, and this is going to reduce the burden on the hospitals and ensure that no one gets to the hospital at 3 a.m. as an 84-year-old woman just to get their treatment for diabetes and hypertension. Basically, we are pleading with government to say, we have entrusted you with the role and the responsibility to ensure that Section 27 of the Constitution is respected. And please implement that and ensure that our healthcare practitioners get to service the masses.
Dr. Mandla, thank you so much for your time. All right, that is Dr. Mandla Matshabe. He is the Mpumalanga provincial chairperson for Samatu there, giving us an insight in terms of the issues that they are facing in Mpumalanga when it comes to unemployed pharmacists.